Another question came up as to how do I treat knee injuries. And again, it's like any of the joints. You have to do a good evaluation first to find out what's causing the knee problem. You ask a good history to see if they had any injury to their knee when they were younger. Were they a car accident? Did they have a skiing accident? Was there some sports-related injury? So isn't it funny how sometimes people have arthritis in one joint, but the other joint is perfectly fine? It's very often due to some type of trauma that occurs to that particular joint at an early age, and you have to go back to the history to find that out. And what I believe happens with joints that go bad versus joints that don't is that initial trauma. And it's very important to reverse that with the use of some of the treatments we do with growth factors, because what happens is inside the joint the metabolism changes. We know that now. And there's something called cytokines, which are interleukins. You can look that up on the internet. And you have good ones and bad ones. And when the body is healthy, it's making good ones every day, and it's making good healthy joint fluid that lubricates the joint. After a simple trauma, these growth factors can change, and your body is now making bad growth factors, which causes inflammation like an acid inside the joint, which can cause chronic pain and lead to arthritis down the line. So we do a good examination. We look for postural abnormalities and correct that. We look for muscle abnormalities and correct that. If there's ligament instability, we'll correct that with prolotherapy and or bracing to strengthen up the ligaments. And you can have various ligaments that are injured, from the ones on the outside called the medial collateral ligament and lateral collateral ligament, or you can have injuries with ligaments on the inside called the anterior and posterior cruciate ligaments. So again, these ligaments can be helped with some of the regenerative techniques. When you develop cartilage problems with the meniscus inside the knee, also the regenerative therapies in the earlier stages can also help with prolotherapy, platelet-rich plasma, and stem cells to help heal these tissues and eliminate the pain. When someone has arthritis in the joint, we often go right to the platelet-rich plasma and the stem cell therapies, and within a handful of treatment we usually can get control of the pain problem.